My name is Brighton Nuffield. I'm a consultant neurosurgeon and complex spine surgeon. The majority of my neurosurgical training was in Liverpool, the Walton Centre. Following that busy training, I organised fellowships in Australia and in the United States, and that was prior to me joining a group here in Brighton as a consultant neurosurgeon. The spinal care that we offer here in Brighton Nuffield is aimed at providing a holistic package, so it's not merely looking at when to operate or when not to operate. I'm looking to treat the patient overall, so we work together closely with colleagues, pain consultants, and if we feel a patient is more appropriate for one specialty or the other, then we'll guide them to that. So a cohesive environment, a friendly environment, a trusting environment, and one where we can excel in professionally and give the patient good results as well. Procedures that we commonly do here range from fusions, spine fusions, neck fusions, to decompressions, freeing up nerves which are causing or generating the pain. My fellowships overseas have allowed me to really modify my technique and allow access to the spine through smaller incisions, through assistance of technologies, for example the endoscope or small tubular retractors. And this can really be a game changer for patients. And for me that changes a lot of what we can offer, where we can get to in terms of the area of the pathology or the problem in the spine, what's causing the pain, and also the type of patient. So a patient who may have been considered not well enough for an operation in the past, with these techniques is considered okay because it's reduced our operative time as well, and the tissue disruption and the healing time is quicker. So overall there's a lot of benefits from minimally invasive spine surgery or keyhole surgery. I'm an expert in this field and trained extensively to be able to offer this to my patients. We have the time and create the time for the patients to ask any question. What we have the time and ability and resources to offer privately is individualized care. So we will listen to a patient's individual symptoms, how they're affecting their individual life. The patient might have a high-pressure job or a hobby that they need to get back to, or a professional sportsman. Their treatments will be geared differently to generally the NHS, and we're able to get that access quicker. There's more of an opportunity to go through scans in detail. Whenever we order an investigation, it's a rapid turnaround, so we don't need to wait for a long time. So often the turnaround of diagnosis can be abbreviated into a couple of weeks, and that provides incredible reassurance for patients, and they then trust the system, and I think that's what we really get here. As with most surgeons, it's incredibly satisfying to see a patient who gets better the next day. It's even more satisfying when it's something that you can't visibly see, which is pain, and that's one of the most common conditions that we see. It really is a privilege to help them get rid of their pain. So when a patient wakes up or comes back to the clinic and is happy with their results, I think that's what keeps us going. That's what got me into this specialty. And the complexity of the work that I do is something else which I think keeps me on my toes, and so there's always an innovation, there's always a new technique, there's always modification of what we do, and it's that constant cutting edge which I feel drives me.